morning, student. Welcome to the class. I am teaching you chapter number 6, Circulatory System. In the previous class, I have explained you about the circulation of blood. Continuous movement of blood containing nutrient, oxygen and carbon dioxide from heart to different parts of the body and back to heart is called blood circulation. The impure deoxygenated blood from all parts of the body is carried by the superior and inferior vena cava to the heart. The heart pumps this blood through the pulmonary artery to the lungs. In the lungs, carbon dioxide is released from the blood and oxygen is absorbed. Then the pulmonary vein return the oxygen-rich blood from the lungs to the heart. The extra or the aorta carries this oxygen-rich blood from the heart to all parts of the body. This is a circulation of blood. Now, today I am going to teach you about the blood pressure. Blood pressure is the pressure of circulating blood against the wall of blood vessels. Most of this pressure results from the heart pumping blood through the circulatory system. The term blood pressure refers to the pressure in the large arteries. Blood pressure is usually expressed in the term of systolic pressure, that is maximum pressure during one heartbeat. For diastolic pressure, that is minimum pressure between two heartbeats in the cardiac cycle. Systolic pressure is the average pressure produced in the ventricles when they contract and pumps blood into the aorta and pulmonary artery. Diastolic pressure is the average pressure produced when the ventricles get filled with blood from the auricles. It is measured in millimeter of mercury above the surrounding atmospheric pressure. Blood pressure is one of the vital signs together with respiratory tract, heart rate, oxygen saturations and body temperature that healthcare professionals use in evaluating a patient's health. Normal resting blood pressure in adult is approximately 120 millimeter of mercury and systolic over 80 millimeter of mercury. Diastolic donated as 120 per 80 mm of Hg. Blood pressure is influenced by cardiac output, systematic vascular resistance and arterial stiffness and various depending on situations, emotional state, activities, and relative health diseases states. In the short term, blood pressure is regulated by baroreceptors, which act via the brain to influence the nervous and the endocrine system. Blood pressure that is too low is called hypotension, and pressure that is too high or constantly too high is called hypertension. And normal pressure is called normotension. Children, both hypertension and hypotension have many causes and may be of sudden onset as of long duration. Long-term hypertension is a rich risk factor for many diseases including heart disease, stroke and kidney failure. Long-term hypertension is common. Then long-term hypotension. Blood pressure is measured by an instrument known as sphygmomanometer. We can quickly lower our blood pressure by doing exercises, consume low sodium diet, then limit alcohol intake and quit smoking, cut back on caffeines, reduce your stress. Dear children, drinking lot of water is best to the blood pressure, lower the blood pressure. Studies have shown that drinking water in which minerals and minerals such as magnesium and calcium are added to water can further aid in lowering blood pressure. So drinking water is best in lowering the blood pressure. Thank you, students.